My topic of presentation is incidence of anterior uveitis in a tertiary eye care center, which is a hospital-based observation study. Introduction. Uveitis refers to inflammation of the uveal tract, which includes iris, ciliary body, choroid. Anterior uveitis is the most frequently encountered form and contributes significantly to ocular morbidity. Patient may present with pain, redness, photophobia, and blurring of vision. Slit lamp examination reveals anterior chamber cell flare and keratic precipitate, significant changes in intraocular pressure. The etiology ranges from infection to immune-mediated traumatic drug-induced and idiopathic causes. Hospital-based incidence studies are essential to understand regional disease burden. This study aims to measure incidence of newly diagnosed anterior uveitis in a tertiary eye care center. Objective. My primary objective is to determine the incidence of anterior uveitis among patients attending a tertiary eye care hospital. Secondary objective to analyze demographic characteristics. Relevance of the study. Determine incidence helps quantify disease burden, identify regional patterns, guide resource allocation, and improve diagnostic strategies. Early detection and treatment prevents complications such as cataract, glaucoma, and macular edema. Methodology. Study designs hospital-based observation study setting, Department of Ophthalmology, Regional Institute of Ophthalmology, Thiruvananthapuram. Study period 1 year. Study population, all patients attending the OPD during the study period for the first time. Inclusion criteria, newly diagnosed anterior uveitis, age more than 12 years. And exclusion criteria, previous anterior uveitis, post-operatic inflammation, masquerade symptoms. Data collection, structured pro forma, documenting symptoms and signs. Outcome measures, new anterior uveitis cases, denominator population and incidence range. These are my results and discussion. Total new OPD cases during the study period 27,789. Among these new cases of anterior uveitis 100. So incidence of anterior uveitis will be 0.4%. This is a table showing percentage distribution of sample according to the age. About 69% of the affected individuals were between 90 to 15 years, reflecting the known trend that anterior uveitis commonly affects the working age population. This is a table of percentage distribution of the sample according to gender. The gender distribution was equal, demonstrating no significant sex predilection in this cohort. This is the percentage of distribution of the sample according to occupation. Occupation-wise, daily wage workers, students, and farmers form the largest group, suggesting possible environmental and lifestyle influences. This is the percentage distribution of the sample according to comorbidities. Most patients had no systemic comorbidities, though some proportion had diabetes, hypertension, and dyslipidemia, indicating that systemic association were not predominant in this population. This is a percentage of distribution of the sample according to laterality. Laterality showed an almost equal distribution between the right and left eye, but there is a 10% presenting as bilateral. In conclusion of my study, the incidence of anterior uveitis among new OPD patients was 0.4%. It predominantly affects the working age population with equal gender distribution. Most cases were idiopathic and non-granulomatous, presenting with typical inflammatory symptoms. Early presentation highlights good awareness and incidence estimation aids in early diagnosis, better management, and prevention of visual complications. These are my references.
Just anterior uveitis in the study population you have assessed. You have removed all trauma patients? No? No trauma.
Removed.
All trauma has been removed. All post-op settings, everything has been removed. Only pure anterior uveitis. Then go into that 0.4%, you can go deeper down and see how many are like tertiary related, how many are like other reasons related, specific uveitic entities or how much. That way you can study. This looks very, very superficial. You're just saying like I saw 1,000 cases in the OPD and I got 10 cases of uveitis. That doesn't have any value, no. It cannot translate into any effective action by anybody. Once somebody sees the study and tries to do something in their next day OPD, nothing much you are giving. You are just creating a superficial study. So go deep down into that particular subgroup and work it up and say, don't miss this, don't miss that. That kind will be more able to.
Based upon your study, you cannot conclude that last line in your this thing, that early presentation is having better outcome and less complication. You have not studied that. Okay.
slide presentation, don't put paragraphs. Keep it pointers. Not more than 5 to 6 lines. First line. Okay.